Aerosol and surface stability of SARS-CoV-2 as compared with SARS-CoV-1. Definition: SARS-CoV-2 remained believable in aerosol through to the duration of our experiment 3 hours. SARS-CoV was more stable on plastic and stainless steel than on copper and cardboard, and variable virus was detected up to 72 hours after application to this surface.
The coronavirus, which causes COVID-19, originated in the city of Wuhan, China. COVID-19 is believed to be transmitted primarily through inhalation. Once infected, most people experience mild symptoms, including sore throat, headache, fever, a dry cough, shortness of breath, and fatigue. However, in a subset of patients, the virus attacks the lungs, causing a much more serious infection. Small air sacs in the lungs add oxygen to your blood cells. This oxygen is then transported to organs and tissues throughout the body. When the coronavirus attaches to a cell, it begins to replicate within the cell. The body's immune system attempts to destroy the virus, which results in an inflammatory response that causes fluid accumulation in the lungs.
Application in nursing. Nursing staff, in addition to direct patient care, are also responsible for keeping the environment clean, free of pathogenic microorganisms that affect the individual. Cleaning and disinfecting these areas, helping to decrease the virus halt time.
COVID-19 is transmitted from the fluids in the nose or mouth of people who are infected. And this occurs when they cough or sneeze and produce small particles we call droplets. Those droplets can travel about a meter in the air and then can settle on environmental surfaces. And people who touch those surfaces and then touch their eyes, nose, and mouth can become infected. The virus doesn't live forever. It will die within a matter of hours, or if those surfaces are cleaned with a standard household cleanser, that will also kill the virus. This is very different than infections that are transmitted by the airborne routes, such as measles. That transmission can occur because the virus can remain suspended in the air from a person who's infected.
Pros and cons. Pros: everyday prevention measures are reaching more people. In this way, it helps to eradicate a virus that is causing so much damage to the entire world. Cons: considering that the longest viability of both viruses is in the stainless steel and plastic, there is more time for the virus to stay alive on surface and anyone can contract it.
A Hong Kong woman fell victim to the new coronavirus after a man residing 10 floors directly above her unit became sick. The South China Morning Post reports on Tuesday that the new cases suggest building pipes could be a path for the virus. Citing the WHO, Live Science reports that the coronavirus, which causes SARS, could get into feces and affect people through leaky pipes because compromised sewage pipes could allow pathogens to move into the surrounding air. Toilets have a U-shaped drain to trap fluids and odor. However, the Washington Post reported in 2003 that faulty plumbing can cause backwash from toilets, which led to a SARS outbreak at another residential tower in Hong Kong. Citing an infectious disease report, Live Science explains that the new virus, now named COVID-19, could infect
NCO apply in Ecuador. In Ecuador, during the last day, a notable increase has been occurred in the number of positive cases for COVID-19. It is important to remember that there are no equal responses by different patients. 80% and infected people are asymptomatics. However, the necessary restriction measures have not been taken.
China officially announces that the coronavirus can be airborne. Speaking at a press conference Thursday in Beijing, Dr. Wang Guijiang, director of the Infectious Disease Department of the Peking University First Hospital, explained the changes in the sixth scheme, 6th edition after amendments, which is China's version of official clinical guidelines for the diagnostics and treatment of the new SARS-CoV-2 coronavirus, which causes the COVID-19 disease. Besides elaborating on the new changes in diagnostic criteria, Dr. Wang said that the new clinical guidelines accepts that not only can the coronavirus be airborne but also that the virus can be transmitted if someone was exposed to high concentrations of aerosol in a relatively closed environment for a long time. Dr. Wang
Conclusion: transmission of SARS-CoV-2 by aerosol myth is positive, as the virus can remain labeled and infection in aerosol for hours and on surfaces for days. They suffer from the accumulation sheet.
How long will the coronavirus live on surfaces?
The doctor is in. It's On Call with Dr. Howard Smith.
COVID-19 remains viable in contaminated spray for up to 3 hours. It can live on surfaces for up to 3 days. This data, just reported in the New England Journal, comes from the NIH Infectious Disease Unit in Montana. The researchers tested the virus in 10 experimental scenarios. The virus lived longest on plastics, that's 72 hours, and stainless steel, 48 hours. No significant virus lived on cardboard after 24 hours or on copper after only 4 hours. Keep this information in mind as you protect yourself from the virus. Clean all surfaces frequently, including your phone. Soap is an excellent virus killer, destroying its outer lipid and protein coat. With health news you should use, I'm Dr. Howard Smith.